Hello, this is Katie Saint, and this research proposal is on the effects of relational frame theory to teach adults perspective-taking skills. This case study includes 3 participants. Participant 1 is a 29-year-old female therapist in an ABA treatment program for kids with autism. She has deficits in identifying others' point of view and social skills in general. She experiences frequent reprimands at work due to saying inappropriate things or offending coworkers. She has no diagnosis and is college educated. The second participant is a 33-year-old male with a diagnosis of schizoid personality disorder. He is experiencing marriage difficulties due to his lack of perspective-taking skills. His lack of perspective-taking skills have also caused conflict in his personal relationships as well as his work relationships. Participant 3 is a 27-year-old female diagnosed with ADHD and anxiety. She experiences a high level of conflict due to her lack of perspective-taking skills, and she also experiences disciplinary action at work due to the conflict she creates. Relational frame theory has been shown to improve perspective-taking skills and social skills even in severe cases of schizophrenia. Deficits in the area of understanding others' beliefs, intentions, and emotions to predict or explain other behavior is called theory of mind. Theory of mind is an important social skill to help people build relationships and succeed in the workplace. Many studies have been published using relational frame theory to increase theory of mind skills. The use of relational frame theory to produce feedback across stimulus sets can reduce relational deficits. Didactic framing is the core process for teaching empathy, perspective-taking skills, and adaptive reasoning to nonverbal cues. The reported use of repeated exposure, feedback, and non-arbitrary trials were vital to resolving theory of mind deficits. These 2 studies are what this research proposal is based on. They were able to effectively reduce theory of mind deficits by using RFT. In the first study, there was 15 adults with schizophrenia, and each participant was exposed to 42 hypothetical scenarios. And then they were asked questions like, what does she really mean when she says this? And what is she hoping the listener will understand? The second study used 3 participants diagnosed with schizophrenia, and the researchers started by training simple reverse and double reverse relations and then got increasingly more complex to generalize that participants were showing theory of mind perspective-taking skills. For this research, there will be a multiple baseline design. The participants will be 3 adults. The independent variable will be the use of relational frame theory to teach perspective-taking skills and identifying social cues. The dependent variable will be the number of correct answers from predetermined scenarios and questions relating to the perspective-taking and social cues. These questions will be asked at baseline to determine skill level at the onset of the study, and the final assessment will be the same questions to compare to baseline their improvement. Additionally, data will be collected on correct answers throughout the study. This study will include baseline, phase 1, phase 2, final assessment, and 2 generalization and maintenance sessions. The same participants will be used that were used in the case study at the beginning of this participant. The first one was the 29-year-old female employed in an autism company. The second one was the 33-year-old male diagnosed with schizoid personality disorder. And the third one is the 27-year-old female employed as a therapist at the autism company that has ADHD and anxiety. This research will be conducted at the researcher's clinic, and materials will include note cards with social scenarios, data collection sheets, and the research will be conducted over 6 sessions. Response definition and progress monitoring will be done through 40 social scenarios presented when the participant is asked, what are they trying to say and what are they hoping the listener will understand? They will be given 2 attempts to respond. If the first attempt is incorrect, they will be given a cue. Progress will be monitored through each correct answer. They will be given 2 points if they get the answer correct the first time. They will be given 1 point if they get the answer correct the second time, and 0 points if they get all attempts incorrect. This data will be displayed in a line graph. The researcher will collect data and video record the sessions. The research assistant will collect data on 30 to 50% of the data to ensure an IOA of 90% or higher. The research assistant will be trained via behavior skills training to collect data. The steps of behavior skills training include written explanation, verbal explanation, modeling, having the assistant practice, and then giving them feedback. Total count IOA will be used to calculate IOA. The formula is the number of correct answers agreed divided by the total number of answers multiplied by 100. Data without an IOA of 80% or better will not be included, and additional sessions will be added. The experimental design will be multiple baseline, and after one participant completes baseline, she will start phase 1. After she has started phase 1, participant 2 can start baseline. Once participant 2 has completed baseline, they can start phase 1. Then the third one can start baseline and start. Baseline will be collected by presenting 40 hypothetical true or false scenarios. The participant will be asked the question, but not given the answer. The answers will be recorded and used as a comparison in the end of the study. Phase 1 of this study includes 40 hypothetical social scenarios that are different from baseline. After being read the scenario, the participant will be asked, what did the speaker intend to communicate, and what do they hope that the listener will understand? The participant will be given 2 opportunities to answer the question. If they get the first one wrong, they will be given a cue for the second attempt. If they get the second answer wrong, they will go on to the next question. Phase 2 is very similar to phase 1, except for it adds 20 additional hypothetical scenarios, and it adds an additional question. The additional question is, how can the listener respond to communicate that they have understood what the speaker was trying to say? Maintenance and generalization will include 10 novel hypothetical social scenarios and asking the 3 questions. What is the speaker trying to communicate? What do they hope the listener will understand? And how can the listener respond to communicate that they have understood this? In conclusion, RFT has been shown to be effective in teaching social skills. More research is needed to generalize the use of this technique with more populations. Specifically, if there could be research focused on using RFT to increase social skills in the workplace or in the context of marriage, it would be beneficial. Limitations of this study include the variability of the made-up social scenarios. It would be beneficial to have a way to assess what social scenarios would be appropriate for where the client is at. Thank you for your time in listening to my presentation. Here are the references cited in this presentation.